So any of you have any Christmas plans, or I should say winter holidays plans? I don't know if you guys.
We're going on a cruise, but not on Christmas. It'll be earlier in December. I work from home, so like you can kind of get away with still working. You know, like I don't have to take the days off around the holidays.
Right.
Family are gonna come and see me, so that's mine. But we're doing a cruise earlier in December.
Where's your cruise to, if you may ask?
Nassau, Princess K, which is like some private island they have.
Yeah, I know that.
Grand Turks, yeah.
Okay, that's dope.
What are you gonna? Is it Royal Caribbean or what? Which or you've taken a plane?
Carnival.
Okay, Carnival. Okay.
How about you, Tanya?
I'm still deciding. I might go to my sister in Canada, in Vancouver, Canada, for Thanksgiving. So since I work at home some days in the week, I may just leave on the Monday that I do work in the office. I'll leave that Monday afternoon and try to, maximize my week, make it an actual vacation. But I don't know, I'm still deciding because Vancouver is just too cold for me and the snow. So I don't know yet.
I know, you talking about you from the Caribbean, you in Colombia. I'm like, you don't get nowhere and you want to go there?
So I don't know yet. We'll see. If not, I might go to, I don't know yet. I want to go home, but I was just there in July. So we got to see.
Yeah, fair enough. I didn't realize your sister was in Canada. But
yeah, that's my older sister. Then I got my two younger sisters. They're in New York now. So who knows? Either way, I'm from cold to cold. So I can't even get away from the cold at this point. So
can't even go visit nobody to be warm.
Yeah, can't even get away from it. But yeah, what about you, Omari?
I'm not too sure as yet. I know I might be going to Trinidad again, or I might be just going to Gainesville, Florida, where my mom and dad are situated at currently.
Yeah. See, there's just no telling where my parents are going to be. My dad, like the other day, I spoke to him. Oh, I'm in St. Kitts. Called him yesterday. Oh, I'm in Guyana. I'm like, you know what? I can't. So
he's living the life we all want to live.
You know what? He working, living his life. My mom, she's in New York by my sisters now. So at least I know where she is. But as far as my dad, I bet if I call him at the end of the week, he's going to tell me he's somewhere else. So
I'm trying to be like your daddy.
I can't keep up. Can I?
Facts. Asyria, if you didn't know, Jada is saying, "Oh my God, Asyria Daniels" in the chat.
Hey, Jada girl. She's my biggest hype fan. My biggest hype fan.
I'm too hype fan.
Like Jada.
Is she the one who took the video on your IG?
Mm-hmm. Yeah. And she makes sure we get a video every time.
That's a true friend.
For real.
You don't need that hype man.
Yeah. Well, thank you all for joining us. Before we get more into, I guess, public health chats or live chats or whatever chats it may be today, just wanted to send out some prayers and some love to Puerto Rico and everyone that is been or is being affected by Hurricane Fiona. I am going to put a link in the chat and as well as in the description of this. If you listen to this on the podcast later on, that so you can donate to Tola Salud, and I think I said that correctly, which is a Puerto Rican community-based feminist organization that is collecting donations to support the communities around Puerto Rico. So just wanted to say that. Today, I'm joined by two lovely ladies. I'm going to let them introduce themselves just because I don't want to mess it up because I feel like they have a lot to say. So I'll pass it on to you. I'll let Tanya go first, and then Asyria can go afterwards.
Well, hi guys. So my name is Tanya Ambrose. I am a public health professional. I am the host of the podcast Tea with Tanya, and I'm also the founder and CEO of a nonprofit organization called Squad Life Cares, and we are dedicated to serving women and youth in underserved communities. And we have a specific focus on reproductive health, mainly period poverty, menstrual hygiene management. To definitely give us a check out. We are studying, holding the fort and trying to bring about change in the different communities, but it is needed. And that's all about me. And I work as a maternal outreach specialist here in Columbia, South Carolina, that I absolutely love. And that's all I think I can say about me. And fun fact, I'm from the Caribbean. If you hear an accent jump out deeper than you expect, you know what? That's why I'm from Antigua. Shout out to my island, Antigua.
I feel like we all have Caribbean roots here. Is that true?
Yeah.
Respect to the islands.
Yes.
So, hello, everybody. My name is Asyria Daniels, and I am a program coordinator for the Center of Black Health and Equity. I do tobacco policy. So, if you know anything about menthol, we are basically one of the 8 organizations that the CDC partners with to do tobacco work, coalition work, community capacity building, infrastructure, things like that. So I work with coalitions across the United States. Yeah, across the United States to build infrastructure to go and, if you know anything about menthol, it is one of the main flavors that is smoked by African Americans, killing about 45,000 African Americans yearly. And so if you know anything in the FDA, the menthol ban, then it's that type of work. But I am also from the Bahamas. I don't sound like them, but we in there. But yeah, I'm just so happy to be here. Just giving updates, and yeah, I'm here, y'all.
Yes.
So one blood for sure.
Yes.
For sure. But yeah, I appreciate you all like taking time to hop on. I know that we were supposed to chat maybe like a month ago, but then things came up. But life happens.
Yeah, life be lifing,
exactly.
So it's okay.
Exactly.
Life really be lifing.
For sure. And I wanted to have this as casual as possible because I know always I'm on this side asking questions, but I wanted you all to like feel free to like take the conversation or like do whatever you want. I'm here just to provide platform, provide my insights, and share some more. And I guess what would be helpful, since this is like a public health podcast, is just to share maybe like 1 to 2 minutes about how you got into public health, or like what you like about public health or love about public health. So yeah.
For me, I always say my journey to public health has been a bit different than many people. Well, I mean, I know all our journeys are different, but I was actually in a nursing program that I failed out of. Okay. A few years ago, my aunt was the one that told me, you should try public health. I was like, what is public health? Because, you hear public health, but you don't really know what it is at the time. And I did my research, and I remember thinking, okay, this is something that I can get into. Still not knowing exactly fully what I was actually getting into. But like, you know what, let me give it a try. Since nursing school doesn't want me anymore, let me try to find something else. And I did my research, and I got accepted to Georgia State University. And since then, here I am. I don't even know, this is not a shade to any other profession, but something about public health. It's so broad that you can do so many different things without having to be, for me, in a clinical setting. And that's where I found my joy, my passion in public health. And then that also led me to even launch my nonprofit organization, because again, we think about being in the clinical setting, and that's the only way we can help our population or help society. And that's not the only way. And we already know, for me, and sometimes I like to be careful and mindful when I'm saying this, what healthcare in the US is, we know, you don't even got to say it. So I try to be mindful. So when I think about it, as a public health professional, we can bring about change in a different way, because it is needed. And of course, with COVID on the rise, when we were in the pandemic, a lot of public health experiences. That's why I got most of my public health experience, as a matter of fact. And then now actually, I can say I found a job that I actually love. Like, I've said it before, but when you actually love a job, like for instance, I have not complained one time in the last 6 months about waking up to go to work. And that for me is a big deal, because I'm
we love that for you.
Yes, I'm not a complainer, but we have those jobs, something like, I don't want to go today, or do I have to go and just complain getting ready. I have not had that issue at all, helping with the health disparities and maternal disparities among women in underserved communities. And that's mainly my primary job. So getting experience working with pregnant moms and postpartum mom. And I forgot to mention, guys, I am a doula as well. So then, everything is in alignment. Everything is in alignment from my, doula life to my day job. So that's definitely what got me to public health and get ready to pursue my master's in public health, because of course, why not, gain more experience, gain more knowledge, and of course to help society. Because again, from someone from the Caribbean, I also realize our public health system in the Caribbean as well is not really non-existent, but we can do more work. I try to be, trying to be nice. Yeah, we can do more work. So even though I'm getting the experience here in the US, and we still have more work to do here as well. From our island girl, as I call myself, I want to be able to give back to my country and even to the region in a way that they may not have, or they may not see the potential from a public health standpoint. Yeah, that's a little bit of a little bumpy journey.
Yeah. I appreciate that. And just to say, like, I had both of these lovely ladies on my podcast. I forgot what episodes, but I will link that in the description and show notes afterwards if you're interested.
So I love that you went to Georgia State, the real GSU. That's where I got my master's at.
Yes.
So,
Let them know that. Back. Let them know that the real GSU. Okay.
They gonna fight me though, because I'm from the Statesboro area.
Oh,
so
okay. Yeah.
It's really divided in my heart.
Yep.
Definitely, as soon as you go apply, you're gonna get in. Let me know. I still got my notes. I still got the teachers you need to get. Yep. So let me know. But as mentioned before, I got my public health master's at Georgia State University. I graduated last year, so 2021. And my road was definitely not public health related. I thought I would get my own clinic, do occupational therapy and physical therapy. I knew where the clinic was going to be located. I had my administrators in place. But God said other plans. When I was at the Citadel, my undergrad, I did a lot of social justice work on campus. They used to call me Sugar Mama, not because I had money, but because I kept everybody in line and check, but I always had everybody's back. If you know anything about the Citadel, it was when I was there about 8% Black, 2%, 3% women. So, and then I was an athlete on top of that. So yeah, just keeping the community within the campus together. We did really good with that. But my mentor saw me on campus and saw my passion for it and was like, you should do public health. And he was a health promoter. And I was like, he does health promotion. And I was like, I don't want to do what you do. Like, that looks boring. I'm not going to motivate nobody to have a healthy diet.
Right.
Essentially, it sounds like coaching to me. And so he really pushed me, and probably 2 weeks before graduation, something just told me to think bigger. And so public health was the only thing that was on my mind. So he helped me to really hone in on what I wanted to do. I really quickly realized that I have a big mouth. I like to talk. I'm good at talking, but I do like to talk. And so what can I do in public health? And he was like, public health law, not going to go get a degree in law. So we got to figure something out. So I did health management and policy. And so that was kind of my journey. I don't think anybody nowadays, I do think, but all my mentors that I've talked to, nobody really goes, oh, I went to public health undergrad and then got my master's. Like everybody's like, oh, I stumbled upon public health and fell in love with it because it is so broad, like you mentioned. But now I am, like I said, I'm the project coordinator at the Center for Black Health and Equity. And I love it. I love it there. I love being surrounded by Black people. We work with coalitions that are Black led. And just, I always say my purpose in life is to do it for God and do it for culture. And so I love that he really definitely aligned me to be where I am now.
That's awesome. That is awesome. You know, alignment, sometimes we don't always know where we're going to end up. And once we get there, you know, there's no turning back. It only goes up from there. And that's how I feel now. Like, you know, like I always say, I've had many stumbling blocks, but I turned those into like stepping stones. I mean, it may sound cliche, but I've turned those stumbling blocks that I've encountered into stepping stones. And then that's where, you know, now I'm in alignment with what I want to do in life. No complaints. Of course, you know, the goal is always to be better and gain more knowledge, but definitely turning those stumbling blocks. Because I know many of us, those of you who are listening here, you know, things don't always go as planned. And I'm the poster child for things not going as planned. You know, like you said, sometimes when we have plans, God is going to say, who said that? You know,
he be laughing at him.
Yeah, he's going to laugh. I didn't tell you that. Why you think this plan is going to work out? You know what I mean? So for me, it's always making sure that we turn those stumbling blocks into stepping stone, because sometimes we can get discouraged. I mean, we're human. You know, I'm learning to feel how I feel if something doesn't go the right way instead of beating myself up.
Yeah,
I can sit in that moment, analyze, reflect, and then figure out how I'm going to get to the next level or the next destination. So definitely turn those stumbling blocks into stepping stone. Like that's my mantra. Turn those stumbling blocks. It's not over. Because I had an issue one time, like, you know, I'm getting too old. I'm older. I think I might even mention that tomorrow the first time we started talking. I was like, you know, I'm getting too old. Still young, guys, but I'm still old at the same time.
You're very young, very, very young.
But in my mind, But we put this age limit on our side, but it's never too late. And my mantra in life is nothing happens before it's time. So like you may be in med school and then stumble across public health, then do what you gotta do, follow your heart.
Yeah.
At the end of the day, if we're not following our heart, we're not gonna be happy. Like I said, for me, I get up every day happy and I'm ready to go to work. And this is not me saying that work is not stressful or challenging, because I mean, why not? We need challenges. But for me, actually loving or liking what I do, I have not complained one time. So let's hope it stays that way. But definitely it's all because I met many stumbling blocks and I had to turn them into stepping stones to get where I am now. You never said too much, but yes.
No, you good. No. You over here preaching. We're going to let you preach.
Okay.
Absolutely. And I think that's important, like how like we all came into this with some viewpoint of what helping people are, especially from the fundamental physician healthcare setting. And then we realized, we can do different things. And then to Asyria's point, like the coaching part, like not to say like health promoters, health educators aren't important, but there are other things that you can do in public health. And to that point, you don't even have to get a JD degree and become a lawyer to do it. There are other ways to impact the system. But I guess I could share a little bit about my story, stumble into public health likewise. And like one thing, as you said, when people get into med school and then they find out about public health and then do it, like one thing that came up just now that I didn't think about in a very long time was when I went to the APHA conference the first time, and I was in I don't know, like a meet and greet type of thing. And I met the student who was in med school and he did drop out to pursue an MPH degree. And at that point in time, because I wanted to go to med school, it like kind of solidified that, it's okay and it's fine to not want to do that, to have other ways and avenues to help people. I stumbled into public health, wanting to go into med school, apply to Masters of Health Sciences programs, medical sciences program, got rejected from 3 or 4 of them, said I didn't want to like do nothing for a year, found out about like just Googling what I can do with a biology degree, found out about the Masters of Public Health. I was like, oh, this is kind of cool. And then within like first couple months, I was like, okay, I don't want to do med degree anymore, because I fully understand like the inequities and just how being a part of the system will not effectively change the system. And for me to put in that effort and time and debt to go into that, to know that that is not where I will fully be happy and know where I can impact the most amount of people, especially Black people, especially people that look like myself. Public health was it for me. And like, I feel like there's just so much you can do in public health. And I'm enjoying the work that I get to do. I'm enjoying like having this platform and just getting to talk with some people like you or as well.
And it's funny you say that. And I'm sure, as I said, we're all from the Caribbean, like Caribbeans see that blood. And, even as Black people, our parents always expected, you got to be a doctor, a lawyer.
Yeah.
All these different.
My dad had a fit. My dad was like, public health, you mean the people who walk around and go check the restaurants? I was like, Dad, just trust me. I have a plan.
And I got asked that question too. I got asked that question and I'm like, trying to explain to them, and it's, like I said, how our parents are. So that I'm happy that, all 3 of us here and even those listening, that we, again, follow your heart and your passion, because there's so much we can do in public health. And I think for me, if I can say this, even after getting my degree in public health, my bachelor's in public health, I was still, I'll be honest here, I haven't really said that out, but I still applied to a nursing program, like a master's entry, nursing program. I won't call the school name, but anyway, but they ended up putting me on the wait list twice. The first time I got on the wait list, I was like, okay, I'm on the wait list, I'm getting closer to being there. And then the second time I got on the wait list for the nursing program, and I had to sit with myself and I had to ask myself, why exactly are you trying to get this nursing degree? Again, this is nothing against, my nurses, because I've been a CNA for a while. This is nothing against, even the profession, because I, somewhere in the back of my mind, still think I'm going to become a nurse one day. But I'm like, really and truly sitting down, why do you think you need a nursing degree? And on one hand, I said to myself, okay, as a nonprofit founder and CEO working in the health disparities sector as part of the nonprofit, I was like, you know what, my goal is to take it global one day. It's going to happen, we're still small, just almost 2 years old, but my goal is to take my nonprofit global. And there's certain things that I want to do. Let me not say that I want to do in my nonprofit. And I figure, a nursing degree would also help. But I'm sitting back and I'm like, why would I I'm like, no, you're a public health professional. You're about to get your master's in public health. You have other people in your organization that are actual MD doctors and nurses that can do, what is it that I was trying to do by going to get a nursing degree? And that's when I had to say,
Yeah.
I had to follow my heart. So sometimes we can get so caught up, again, analyzing our why and making sure that the why is clear. Get that clarity, because that's what I had to do. I'm like, here I am forcing, it didn't feel at all organic most times, I'll say that. So then here I am forcing to get into a program that's obviously putting me on the wait list twice now. Why not focus or put that attention into my master's in public health so I can use that same expertise and knowledge to continue to grow and build my nonprofit. So that's also where my mindset is. So I guess I'm just saying, don't just do something because you think it's going to be beneficial. Because like I said, I have a doctor or director of health in my organization. She's an MD plus a professor, I have nurses within the organization. So why do I need, but also I also have a delegation issue. So, it could have been that at the time, but so I just want to say, we have to follow our heart. And I am truly happy with, the decision that I made, and hopefully I can get some answers in the next few weeks. And they tell me, yes, you're going to be in our school for your MPH. We're just going to wait and see. But I'm keeping the faith, and I know I'm going to get in, so that's not even an issue.
Right, you get in. You're definitely. But I love, I love that you bring that up, because most of the time, the people I've talked to that are newly MPH, they go, well, I have to go do this, or I have to get a nursing degree, or I have to pair it up with something. And not to say that you can't, right? Like, not to say that you can't. But when you have your MPH, you are the expert in public health.
Yes.
Go find you a nurse that is the expert. Like, they're the expert with that. The MD is the expert in that. But take pride in that you are the expert, that you look at the greater good of health. I can't express how much of all my experiences public health has helped me, not in the theoretical sense, but putting my experiences, my personal experiences, can't talk, with what I've learned in the book to put together. And that is literally my expertise, because I have the framework of public health. Like, I commend nurses. My mom is a nurse. Shout out to Zandy if she's on here. My mom is a nurse. She told me all the time, go be a nurse. You'll always have a job. Go be a nurse. Go be a nurse. And that's great. I have friends that are nurses. So when I have questions, I hit them up. When they have questions about community partnership, how can they get out into the community? They're coming to me, because that's not something that's on the forefront of their mind. Right. And so I'm glad that you bring that up, because I don't think we talk about it enough. As public health professionals, I think sometimes we just go, oh, we're in public health, and we leave it at that. Like, do you not know, like, public health is in every aspect of our lives?
Yes.
The stoplight, the
road you drive on,
right? The sidewalk, how doctors talk to their patients. Like, I was in a clinic setting for a year, so I did the insurance verifications. I got to know our patients, but from a public health mindset, the operation side that I got to learn about health management, like, that helped. So just being proud that we're public health. Like, yes, you can go and add on to it. I'm not. We're going to stick with MPH at the end of the name. And that's it. But definitely I don't think we hype public health up enough to know that it is needed, it is wanted, and we as the professionals in it celebrate it.
And life doesn't necessarily go on, or the population or society, without public health. Like you said, the stoplights, the train, there's so many different things. The
policy, epidemiology, like biostatistics, like just every
environmental health, there's so many different things,
like
that
chef.
Yeah. And I found myself telling people that I'm like, everything you think about, everything around you right now, honestly, is public health. And they're like, what do you mean? And then, I find myself explaining, which is fine, because right now our job is to educate and let them know about our feeling. As you say, be proud. Because for me, I'm usually, I'm just I didn't feel confident or comfortable in the past saying that I'm a public health professional, because I only had a bachelor's of science in public health. I'm not gonna even lie to you. Like, I do, like, who
girl,
are you?
You better be confident.
I am. But in the beginning, I used to like, let me hurry and get my MPH, because that way I'll be somebody who I can come and say a public health professional. But I was like, no, girl, you already did your research. You did all these different things. You know what you do, and you gain the experience in this field, to the point that, I had brand reached out for me from my nonprofit, wanting me to be like an expert panelist, on their little here I go saying little. You know what, words, we gotta watch our words, guys. It's not little. It's on their to be part of their brand. And I was like, I was excited because my organization is gonna get more exposure. And then I said, like, wow, I said, me be a public health expert, what do I know? And of course, that imposter syndrome. And I'm like, you know what? My sister's like, Tanya, you've had all these years of experience from a clinical standpoint to even know in public health. So why are you telling yourself that you don't belong here? Like, why are you feeling? And I just had that conversation with her today too. She's my younger sister, but she's older. She's wiser. Shout out to Chloe. Her is in grad school at NYU doing her global health master's in public health. But definitely want to make sure that we are confident, like you said, when you said that we have to be proud of our profession. Because again, I truly feel like without us, certain things can't function in this whole system.
Oh yeah. I listen, because we tearing the system down and we building it back up. Like they need us for all of it. I think I said it in the first interview that I did with Mari, like every part of the revolution is needed. But when I look at that from a public health standpoint, every part of the revolution is led by public health, regardless of if it's community organizing, policy, rebuilding, the operations, the epidemiology of it, the stats from biostats, like from a global standpoint. And so I am very proud when people say, oh, you just do public health, big public health in the room. Stop playing with me. Big MPH. Okay. Like, talk yes, nice. I do. Right. Talk nice to
me.
Put
some respect on my name. How about
respect, that? Period. But I do think like we have to do better with it.
Yeah, that's definitely an underlying issue is the fact that we aren't. Well, I feel like it's hard to be visible in public health. Granted that it's just everywhere. It's hard for people to conceptualize that it is a thing, especially granted in the regular narrative. It's not something that people talk about. As we said, physicians, nurses, engineers is what you hear about when you want to help people. But as you said, there are just so many opportunities and ways to get involved in public health. And I wanted to go back to something Asyria said earlier. So talking about like the culture, and as well as talking about dismantling and rebuilding the system. And as we are in public health, trying to get like populations healthier and living better lives. Well, what are some of the things that you're seeing from your perspectives that are like hindering the culture from progressing? And I'm guessing this could be his own conversation. I probably should have prepped you all, but we're going for it.
Go ahead, Asyria. I feel like you have a word coming for us.
Ooh, child. What is hindering the culture? I think we'll keep it simple. We the last couple of years as a culture has come into this mind frame of really talking about mental health. And so one thing that we're opening up to is taking away the stigma. So I'm just going to say stigma in general, because I have experience in HIV and AIDS as well. And so I think what hinders the culture is just the negative stigma that we, the culture, have put on to certain aspects of health and life in general, when in all actuality, HIV, AIDS, mental health, because I'm talking about those two, that can happen to anyone and everyone. And it looks different for anyone and everyone. And everybody's journey within it is different from anyone and everyone. So I think one thing that hinders culture is just the negative stigma that we continue to perpetuate through generations of generations, instead of taking the time out to learn about it, to read an article. I remember when I first got into HIV and AIDS, I did it at Aid Atlanta in Fulton County. And I remember a picture and it said AIDS and it says only gay men get it. But by the time you had read the whole picture, it said gay men, it said straight men, it said women, it said children, because they're born with it. It said you can get it from this and that and that and the stigma starts off with one population and we keep it like that for years and years and years. But when I was a linkage coordinator, that wasn't the case, right? It could happen to anyone and everyone. So I think it's the stigma and not being able to educate correctly or wanting to get educated correctly about the stigmas that are out there. Because although we're talking more about mental health, Some people are just like, oh, mental health, like you're crazy. Like, no, there's really serious stuff. Like people be going through things. And if COVID didn't show you that, like, I don't know what else to tell you.
Yeah.
Yeah. So one of the things is just stigma, the stigma that follows in the places that we work in and the opportunities that we get to work with our people in.
And to add to what you're saying, I think like now there's so much the internet and there's so much information out here, but at the same time, I like to call it information overload, which you can never know. You can never have too much information, but then at the same time, we're not deciphering the information the right way. Like we just, you see one little word, like a little buzzword or clickbait headline in something, and then we're taking that and then we're not actually reading the actual article, or the article may not even be as accurate because again, it's all these different assumptions or ways to see who can put out this story first or put out this, Instagram post first, and then it gets reshared a million and one times, and then there's something inaccurate in it. So we're not always also digesting, accurate information. And that sometimes I think for us as public health professionals, it's kind of get hard because it's like, here we are with the actual, evidence-based research and all these different facts. And then here is somebody who may be in a sense more popular and just pulling a few words or lines from something that they read. And then we get in a sense drowned out because you are here again more popular, or you may just have a particular word in your little slide that says something that's buzzworthy, and then it gets misconstrued. So I think in addition to the stigma, it's also not getting the actual the right information that we need, especially because I know COVID, that was a time like that's when I knew we were really
girl, I was in the clinic working.
That's when I knew we were really heading for something, because people, like the amount of information, and I kept screaming at the TV, kept screaming at my phone. But I'm like, it was just a challenging time because people were just going to read what they want to read,
Yeah.
And then even as you said with mental health, I think my concern sometimes, which I try to mind my business, is always, are we saying something because it's trendy?
Yeah.
Because as you say, people think, when you think about mental health, oh, this person's crazy. Oh, I'm just going to go see my therapist, which is good. Kudos to you for doing that. But are you really going because you need the help and you're actually applying what you're learning in your session?
And you're doing the work.
Right. Or is it because it's trendy? Oh, my therapist said this, because I've seen a lot of tweets about, oh, my therapist said this. And I'm like, oh, that sounds kind of wild. Well, again, I'm a therapist. I don't know. Also, that's maybe my little judgment coming out. But, we do. I'm just being honest. Therapist. Yeah, that's not biased.
You sure your therapist said that? You sure they a therapist?
I'm just being honest, guys. Do not come. Okay, do not come for me. So I think sometimes that's another factor too. Again, even though the stigma, but also, are we just doing things because it's trendy, or are we really trying to push the culture forward and definitely remove the stigma from something like mental health or even HIV and these different things? That's all I'm gonna say.
Yeah, I just want to undergird, and just to make sure everyone understands, and I know that you all definitely understand that we also understand that there are systemic barriers and systems that have been set up to keep us unhealthy and put us in a culture of unhealthiness, or whatever you want to call it. But I think those two things are very important, both on the stigma side and having conversations. And it's important that we're having the conversations, but it's just the start of everything else that needs to happen. But I'm happy that it is happening. And I think to the point of too much information is interesting, because I feel like people get very comfortable. We are very comfortable as a people, because we can just literally sit down at night, go on our phones or go watch TV and just pacify ourselves from the things that are actually happening, or actively engaging into the things that are going to actively make our lives better. And granted, like, I'm not trying to be someone who says like you can't watch Netflix or you can't go on Instagram, because we all need rest, and whatever that means to yourself. But like, when that rest comes into play to hinder the progress that we can make as a collective, I think is something that we also have to think about. But it's a challenge. That's for sure. That's for sure.
It is. It really is. Well, I do want to ask you guys a question, if you don't mind, Omari. I saw a post today stating that the president said that the pandemic is over. And then when I saw that post, I thought, maybe let me go get my glasses, because I probably didn't see, the right thing. Sometimes I do wear glasses, guys. So maybe, I just was not getting my words mixed up, but I was not. And how do you guys feel? Again, we all have our own different personal views, but someone who's our leader, given that we know the state of this COVID situation, how do you guys feel this is that our president is now saying that the pandemic is over, knowing what's probably to come in this fall? Because we got to go through that fall period where cases may rise, because here in Colombia, like, cases are back to rising again. So, again, different states, everything is different. But how do we feel? How we as public health professional can react to something, again, coming from our president? And did he misspoke? Well, I had to go see if I again, when you see something on Instagram, you got to make sure, you got to fact check it. I'm sorry. But then I saw the clip on 60 Minutes. I'm like, well, hey, it's here, so yeah, it's a thing. So how do you guys feel, and especially what does it do for the field of public health when something like that?
Yeah, I think it's mixed feelings. I have a public health mind, but I also live in the real world, in society. And so, again, I'm in Atlanta, so I don't think Atlanta really ever
got COVID.
Girl, shut down.
Because I used to live over there. I just moved here 6 months ago, so I know.
So yeah, I don't think we ever shut down, as a city, as a community. So being in reality, it looks like it, right? It looks like it. People don't have to wear masks. Traveling is opening back up. You don't have to be vaccinated. The big thing was, do you have to be vaccinated to participate in everyday life? You don't have to do that. And so when you're not public health minded, you can think that, the pandemic is over. So it's very mixed feelings, because on one hand, I look out and I go out and I'm the only one with the mask, or I'm the only one that's trying to wash my hands every hour, 2 hours, or I'm like, oh, you too close. But then on the other hand, I know public health, and I know, different environments, different seasons bring out different things. We know about COVID, the fall, like you said, the fall and the winter is coming. So cases are going to rise. I think also because we have kind of gotten a hold of it and people are vaccinated, to the public, it is over. We've done what we were supposed to do, right? If you got vaccinated, you got vaccinated. And that's definitely your choice. I'm a person of choice. If you got vaccinated, you got vaccinated. And if the narrative is, if this many people get vaccinated and, then we're okay, and then we reach that number of people, the public's going to think that we're A-okay.
Right.
So it's definitely mixed feelings. I think, this is going to be something that we struggle with to years to come, because COVID is here, right? COVID is here to stay. I think it's going to be something like we do, like the flu, go get a flu shot every year. I truly do believe it'll be something like that, to that effect, every year. Oh, COVID season is around, things of that nature. But to have the president say it, to that point, I think we as public health, sometimes we are leaders, and it's no judgment to them, but because most people don't identify public health as a leader in public health. Even our public health leaders, when COVID first happened, it was a lot of separation for public health leaders. So we weren't even unified. So to have our leader go on and say that, it just depends on where he's getting his information from. Again, too much information can be just terrible. And so because we didn't have a united front as public health, as a medical field, as community health, as to what was going on, if we're divided, how do you think the public's going to take it?
Right. That's a good point.
Yeah, that's a great point. I think to the bigger conversation here is, if this is how we're going to be putting out public health information, then we have a bigger issue. And I think that's been the issue for the longest while.
Yeah.
Just that, as you said, there's no unification in public health. There is very poor guidance on how they're communicating with the public. And then when someone does something, or I always think why, or who benefits from this? And not to say who benefits from this is election time. They're trying to promote whatever they're trying to promote,
right?
Trying to get the economy back, or whatever the case might be. So I think to Asyria's point, a lot of people have been living like the pandemic is over. Kudos to all the people who, whether you wear a mask or you don't wear a mask, you're testing if you feel sick and you're staying home when you are positive. I think that's one thing that we could do, just to be kind to everyone else around us. But it's a tough place, because like for myself, I know that I've been traveling a decent amount. I've been going to places and with a lot of people sometimes, but definitely have been testing. If I have become positive, which I have only twice during the entire pandemic, which I think is relative. I don't know. Just making sure that you can stay home. And I think like that's the kind of mindset that we need to have. And that's like the public health mindset at this point in time. But yeah, it'll be interesting going into the winter, what will happen. Very thankful that no strain that is coming out is more deadly than what we have seen before, which I think is helpful in the bigger scheme of things, that people aren't getting as sick as they were.
Yeah.
So it's not, I wouldn't have approved that step, but it is what it is.
It's a wild ride. COVID is a wild ride, to say the least. So I can only imagine, like, back in the day, right, when the Spanish flu happened, like, I just think about times like that when the information was coming out. Like, if we have, and again, to your point, too much information can be terrible, but they didn't have all the information that we have. So imagine back then when it happened, and the information that they're getting and how they reacted. And so if we have all this information and we still can't be a united front, like it's gonna be a wild ride the whole time. Like it's just gonna be a wild ride, because we can look back into history and see effects of pandemics. And we have the evidence for it. Numbers don't lie. Evidence doesn't lie, right? It just doesn't lie. It's in our history books. You learned about it. So it doesn't lie. But if we can't be a united front as leadership and as communities, whatever community you fall into, because intersectionality is definitely a thing. But whatever community that you fall into, if we can't be united, then it's going to be a wild ride, regardless of what we want it to be as public health, and having that mindset as a public health mindset or a greater good mindset.
Yeah, and I think like a bigger issue that's underpinning the Biden administration as well is the fact that they get rid of the public health emergency. So a lot of funding for a lot of programs that are happening are going to end, and a lot of jobs are going to be cut. So there are going to be a lot of gaps that I'm guessing will need to be filled in the next 6 months or so. We will see. We will see. That's for sure. But yeah, we live in a crazy world.
We are.
Yeah, and it always boggles my mind. Like, and I'll take some shade, push some shade on like tech people. Is like, yes, we have cool social media apps and stuff like that, but why don't we have apps that are actually like hugely benefiting a lot of people? I think of like societies, like as society, we don't incentivize that, which I think is I don't know, I guess something that I would like to do, potentially. I don't know if you're looking for someone. No, I'm not looking for a position. Just kidding. I'm good where I am.
Shameless plug. Go ahead.
Plug it in. Put it, claim your stake right now. Well, no, I agree too, because we have all these apps and everything on our phones, but yet still, as you say, what is the end goal, or what is the bigger goal? As it relates to the greater good of the community. But who knows? Sometimes, as they say, money, as they say, money run things.
Definitely. Definitely.
We'll see.
Yeah. And to give a tangible example of how money is gonna, like how money run things in like interesting way, I'll give big topic here. Like if you look at big gas companies, Chevron, BP, etc., they have been a lot of the reason why we have a lot of climate change that is happening right now, why a lot of people are dying because of hurricanes and will continue to die.
They have us in a chokehold.
And at the same point in time, they are the companies that are investing like millions or billions into renewable
Yeah.
energy. So they're going to profit on it on both sides. So it's a very interesting world that we lived in that incentivizes like not the right things. But I think that's where the government has to come in with policies to incentivize greener or just carbon neutral solutions, and then companies will do that. But yeah, that's big high level stuff.
Yeah.
One other thing I wanted to ask, like culture, but like culture of public health. I've been having this conversation. I feel like I spoke with Samir maybe a year or something ago, and he was telling me about public health needs to change and we need to be like preventionists. You know how you have like people in the technology field, you say they're in health tech or they're in medical devices tech or whatever the case might be. We need to have like government preventionist, philanthropy preventionist, help, and having like public health rebranded. And then more recently, I had a conversation with my partner Win over the concept of public health. Like everyone generally thinks it's like governmental or big NGOs type of thing, but there's so many, as we said, public health is broad. It's very, very broad. And even so, in public health and the people in public health, and I think about this in my MPH program, we don't generally have a culture of well-being, or we want to research the things, but we individually don't have a culture of well-being to do the things that are healthy, to set up things that are easy, yet we're trying to like impact the lives of people who are in lesser health. Granted that we have our own vices, et cetera,
Yeah.
But I think about that a lot more, like the narrative around public health and what is the job of public health and how do we show up as public health professionals to actually not only work in the community, but work individually on ourselves to create that culture of wellness and health and equity. So I don't know.
I think to add on to what you're saying, the narrative around public health, you know, most of the time we get into public health. I got into public health because I realized at 23, not everybody has health insurance. And so I came from a military background. When I turned 23, I got kicked off. I was devastated. But my mom was like, people like live lives without this. And so that was the initial reason why I got into it. But when I got into it, it was drilled into me. I mean, it's not a bad thing, but to your point, it was drilled into me. The narrative is for us to help underserved communities or minorities. And I think because that's just the driving force. And then when you think about public health, you think about that. But when you think about global health, you think about overseas, lower income minorities, things of that nature. And I think because we have that type of narrative is why we don't personally, as a collective, do it in ourselves. Because I think, and this, somebody gonna get mad at me, but part of it is we feel like we have a savior complex. We have this savior complex that, oh, we're gonna go get this degree, we're gonna learn all that we need to learn, and then we're gonna go into some poor community and go help them. And I personally, in my field that I work in now, you know, we have coalitions all across the country. And the first thing that I tell them is, yes, we have a framework of how we do things, but I am not here to just tell you what to do and that's it. Like, this is a partnership. You're learning from me as I'm learning from you. And I think because we have that narrative of we're going in helping lesser people, then we get this savior complex of, well, since I'm helping them, I don't have to be as disciplined in my life, in my community, in my circle to even model what I'm teaching other people. And so like you just said, Mari, like I've been thinking about that too, because then it makes me look and go, I'm helping coalitions with, you know, tobacco and menthol, but you know, if I don't do hookah, but what if I did hookah? That's still the same thing, you know, just things of that. And it can be something as small as that. But it's the narrative that we've right. But we're not gonna get on that. I'm not gonna get on my soapbox. This ain't about that. But it is. You know, just that narrative, and we have that savior complex, and we think that we're better because we have the tools to go in and help a community, when in all actuality, that community is giving you the information for your job to even be successful. You can't do, public health cannot do anything without the community.
Okay.
It's vice versa.
Mhm.
Like we're not going in playing savior and be able to do everything. They have to be willing and trusting us to even give us the information to do what we need to do, to get the stats that we need to get, to implement the frameworks that we need to implement. And so it's definitely a partnership, but I don't think as a whole, public health looks at public health as a partnership. And so.
You better preach, honey. You know, you said something for me, like I said, with my nonprofit, I'm talking about, you know, serving those in underserved communities. Again, that's how initially, you know, my let me help people who are, again, that savior complex, because again, my inspiration for my nonprofit came from my study abroad to Uganda, Africa, you know, and then, you know, working with people in the slums and doing the heavy lifting or the groundwork and seeing, you know, how people are actually living. And then I remember speaking to someone when we were in the slums, asking them, I forgot what question I asked them, but they were in a sense content. Whereas me coming from the privileged United States thinking, oh, you know, here they are living in the slums, when to them, they're living a good life, right? So then I had to change my mindset from having that conversation with that man in that community. That was one thing. Even when I went home back to Antigua, I was telling my sister, I said, okay, here I am talking about wanting to, you know, mention period poverty and menstrual hygiene management and talk, you know, educate and empower these individuals in the underserved communities. But I'm like, no, I say, first of all, we have to go back to the drawing board. First of all, do the research, get the data. How do we know that we only need to be serving those in the quote unquote underserved communities? Because I'm telling you, like I was telling her, I went to the store and maybe Tanya and Omari, I went to the store earlier to buy a pack of pads. It was like $15. And I'm just like, here I am, you know, with a decent job.
Wild.
You know, I can pay my bills on time and everything. And I'm complaining. I'm like struggling, you know, buy a pack of pad. And I'm thinking, okay, a pack of pad for $15 with 20 in it. You know, what if someone who has like a heavier flow? That's not going to last a cycle. You know, so you know, so these are things I started thinking about. And I said, we have to go back to the drawing board from my organization standpoint and not just say we want to serve those in the underserved communities, because again, you know, it's for me personally, from a personal standpoint, is that savior complex. Yes, I know they need the help, but I also got to make sure that the research is, you know, evidence-based. I can get that data before trying to make an impact. And that's something that I had to, again, it took a toll on me in a sense, because, you know, you want to help and, you know, you're already laying the foundation, but I have to go back to analyze myself as a public health professional now. Like, you know what? No, we have to make sure, again, why is it only the underserved? Because there are people in other communities that I need to be partnering or also need help or also may need the education as well. And, you know, so again, as you say, we got to come together as a collective and not just think we got to be the savior for a particular population. And then we've had that for years now. Again, for me, thinking, oh, you know, only certain people will get certain diseases. And that's not the case now. Like we have to evolve. That is not the case in these times. And that's, so when you said that, I said, you know, that's so funny. That was my mindset with my organization. I'm like, you know what, no, we can say we want to give to the underserved. Of course, we are going to do that, but we have to go back and analyze now, because there are the people in other communities, you know, that need help. And then it took me like, I'm like, $15, honey, you know, so I started thinking about other people, you know, thinking about what, $15 for a pack of, you know, but anyway, that's a whole other story again. Like that just gonna get me upset. So, but yeah, that's all I'll say.
I think too, to piggyback off of that as well, I remember a really good friend of mine was applying for a job. She's in public health. She has her master's, she has her chest. And she was applying for this job. They gave her like 3 cities to look at and to see what needed to be done. And I remember talking to her, and from this savior complex, I remember talking to her and going, well, did we look up the cities? Did we see like what they would want? Like, I understand that we're the experts and I understand that we have the knowledge, but I think too many times too, public health goes into communities and say, this is what I looked up. This is what's wrong with you all. And this is what we're going to do, instead of coming from a community-based, a grassroots place going, okay, what do y'all need from us? What can we help you with? I remember one of the cities that she had, I think it was something like food nutrition that they were going to be doing. But when she looked up the city, it was really job security. Like that's what they really wanted and needed. So imagine us putting a whole bunch of money into a city for food security. And yes, that was needed, but the main thing that they were saying that they wanted was job security and things of that nature, to have a better housing, to have better jobs, to get a better education. But then we're just going in with just food. So that savior complex looks different within public health, but I think as a whole, we do have that complex of, oh, we're the experts, so we're going to go in and tell them what to do. And that's why I tell my coalitions, I'm your partner. I understand what my title says, but I cannot help your community because I don't live in your community. I don't know what's going to make this community move. What I do in New Orleans isn't the same thing as what I'm going to do in Pine Bluff, Arkansas. It's not the same thing I'm going to do in Portland, Oregon. And so I need you to help me to help you so we can be a team and make it work.
Yeah, absolutely. And I think that narrative change is important. And just knowing that, like, we're here, we do serve, but in addition to that, we're like empowering the community. We're hearing their voices. We're creating those partnerships and those networks. Because I think, like, the high level point is, that's what didn't happen for decades. They didn't have the community in conversations about how to build the systems around them. And that was probably intentional in a lot of regards, but then also unintentional in the sense that, okay, this is how it's been done, and we're going to keep on doing it this way because we know best. But at that point in time, we're having this change and this reflection that, okay, we need to really, if we want to get the systems changed that we want to do, we really have to engage those community members and ask them their solutions and give them space to talk. And when they talk and they share those things, actually work to move forward. And move forward and not just say, oh, okay, that's cool, and move on. Because and that's one thing in like public health as well is like the programming versus the systems level thinking. And I'll always look at it in the perspective of, well, food. If you look at food insecurity, okay, backtrack a little bit. Food insecurity, a lot of issues in public health and just general to people and communities is around not having living wages and economics. So that's one part. But then going back to the systems level thing is, we say that a program is successful because it's increasing the amount of food that is giving to communities. But we're not looking at the root cause of, okay, why is it that more people need food? It's because they don't have the jobs, they don't have the living wages and things like that. And I think that narrative of like, what is success in public health? Is it that we're serving more people, or is it that we have systems in place that people are just able to thrive without needing these programs to support them? And I think when we have that perspective, and granted, like, we need a lot of help to save people in programs right now.
No, I'm not saying
shut down food banks. But I think too much of the attention has been focused on just that, but not looking at, okay, how do we shift those policies or create larger impacts with community voice to really ensure that there is that large systems change. And that's something I think about all the time in the work that I do, especially with like smaller grassroots organizations. Just like, yes, I know that there's this need, but we have to work with organizations that not only see that there's this need here, but there's system level things that not only they know they can address, but they need to like gain partnerships and networks to get that power in that network to affect change at whatever level that might be to help them. And
I agree.
That's like a very, very tough thing to do. And like, I'm guessing that a lot of us are going to be working our entire lives, hopefully not our entire lives, but
majority.
Not yet. Right.
Yeah, to fix these kind of issues. Yeah.
Hopefully that comes sooner rather than later, but it's coming.
Absolutely. And that's why we need these kind of conversations. And I didn't want to leave Jada's question unanswered, but she wanted to ask, what are some areas of public health that you're interested in exploring in the future?
That's that's a good question.
Right. Because you just kind of get stuck. I think everybody starts in like HIV and AIDS, because that's how like everybody gets introduced, and then you kind of find your thing after that. But something that I'm interested in, I think, because I have a health management and policy degree, I would really, really love to be more on policy side, not writing it, but more of the face and the voice to advocate for policy. So I'd be interested in that. And then this is gonna sound wild, so don't judge me. But only because of the teacher that I had at GSU, I struggled with biostats, right? And I cried every night. I
should be laughing at you crying, sorry.
No, for real. But she was a great teacher and she made it so relatable that interests me. Like, I don't care about numbers, but if I had to go into something else within public health, I think it would be biostats and trying to give the data, the numbers to people to help communities. But that's a long shot.
Right. If I had to, somewhere in the future, I probably want to do policy as well, and also maybe epidemiology. Don't ask me why, but I took the class and I loved it. And then now, with the work that I'm doing, and especially when I think about my home country back in the Caribbean, I have to always think about Antigua because that's the only reason why I'm surviving in this country as well, But when I think about it, again, even from the Caribbean region, like, data is just non-existent. Like it's there, but not enough. So I think I'd want to, be able to work doing something with data collection as it relates to how can we better help the population in the Caribbean? Because, again, we just think, okay, we're planting our foods or we're going to this. There's just so much more that, again, I think we need to change the mindset back home on policy, because I just don't believe there's just certain things that I just can't agree with. And I feel like I need to be able to be in the room or something invoking change, because some of these policies, I don't know, but we'll see. Well, one thing at a time, because, just getting into this thing here. So we gotta ride this wave for a little bit.
When you get into public health, you be like, I want to do this, I want to do that, I want to do this. I'm a volunteer for. Listen, my internships all over the place. I was in everything. Because you see the injustice. You go, why are we still talking about this? You go, we could have already fixed this. But then you realize systems and building blocks, and
I'm learning
we can get rid of. Right. You can get rid of this system, but what are you going to replace it with? And what is that going to look like? And how is it going to be funded? And who's going to run it? And how are we going to get the stats for it? And how are we going to know where this girl, how can
we get the impact? It really is a lot. Yeah. So one step at a time. What about you, Omari? I'm curious to hear your answer.
I have a lot of things bubble in my mind all the time. I enjoy the work that I do with public health philanthropy, doing a lot of work with Black communities, grassroots communities, which I think I continue to learn, which I think that's what I enjoy a lot about it.
Yeah.
In the future, I think to that point of why don't we have the technologies to be able to affect change? So maybe in that health tech space, maybe I stay in public health philanthropy and just write it up from there and see how I could impact communities, especially Black communities, in positive ways. As well as the Public Health Millennial, I love having a podcast, having a space just chat with people. So I think this is something I also enjoy in public health, and thinking about how can I continue to build this, continue to have a platform that helps people to share stories and insights. So I think there's a lot of potential in the future, and I feel like that's the case for many people in public health, which I think is awesome. So we will see. We will see.
One day at a time. That's for sure.
Absolutely. All right. Well, it is 6:30.
Time went by.
I know.
Yeah, that was quick. That was quick. Yeah. We need a part 2.
Okay.
We wasn't done.
we can do that. I don't mind. We can definitely follow up that's for sure. But I appreciate you all coming on. Be sure to like this video or leave a review if you're watching. Leave a review if you're listening to this on a podcast platform. Greatly appreciate it. Subscribe to my YouTube. Trying to get to 1,000 subscribers, so please do that. I should have mentioned that earlier on, but regardless. Tell the people where they can connect with you, and I'll put your information in the video afterwards as well.
Yeah, so I am on Instagram, so you can connect with me there. At __a.ray, so RAE. And then LinkedIn is Asyria Daniels. I'm pretty sure I'm the only Asyria Daniels, but you know, big MPH over here. So Asyria Daniels MPH. And if you're trying to look and see, you know, if it's the correct one, I have red locks, I have the nose ring, and I have Angela Davis as the background. So you already know it's me. It's me. You found me.
For me, you can find me on Instagram, Facebook at Labor. I forgot my name now. Wow. Labor with Tanya K. And then if you want, you can check out my nonprofit, shameless plug here. It's called Squad Life Cares. We're on Instagram, LinkedIn, and I am also on LinkedIn as Tanya Ambrose. You will see me. I am the girl with the braids, the high forehead, you know, just look for me with the beautiful smile. I'll take that. But
I love that. I love that.
Me too.
But definitely check out my nonprofit Squad Life Cares on Facebook, Twitter, Instagram, LinkedIn, and of course, check out our website, www.squadlifecares.org. And yeah, just, you know, whatever we can do, you guys can do to help us improve, definitely do that. We're actually on the hunt for some board members, so shameless plug again. But anyway, nevertheless,
say less.
We're gonna talk. We're definitely gonna talk. But that's where you can find me. And of course, feel free to DM me. And of course, my podcast. Oh my, how can I forget that? My podcast, I host the Tea with Tanya podcast where I talk about health and wellness, and I share some public health stories and just, you know, on this journey to be my best self. And I know that may sound cliche, but like we mentioned earlier in our conversation about how can we as public health professionals inspire or empower others when we're not actually living it. And I've had that revelation. So I'm just on, you know, my journey to sharing about maternal health. That's what I work in, public health, and just health and wellness. Because, you know, I need to live, you know, for as long as I possibly can optimize my well-being. So yes, guys, Tea with Tanya podcast. I'm almost at 5K downloads. So please, you know, help a girl out.
Yeah. That's awesome. And look out for Tanya getting into a massive public health program as well.
Definitely.
Yes, can't wait to get the message. I got in.
Yes.
Same. Well, if you listen to this and you got this far, you know where to find me. Be sure to join the community health and wellness Discord at thepublicmillennial.com/join. We can chat more about public health, community health, wellness, and everything in between. Peace, everyone.
All right, and thank you.